Hello, Dr. Wallach. Okay, my sister Charlene just came from the cardiologist. We're sitting in a car, pulled over, and it's a miracle we got through to you. Okay, so it's her birthday today. She's 57 years old. She's 240 pounds, 5'7". She has a right coronary artery that he believes she was born with a defect. So when she was shoveling snow, because of the symptoms she told him when she went to get one of her medications refilled, because of what she said, it's hard to shovel snow and it's hard to breathe, out of breath, they put her on the treadmill and she went to 270 her high blood pressure. So now they want to do open heart surgery and reroute, take an artery from her leg, and so she's on 4 medications. They want to do artery bypass surgery. She's on 4
Okay, stop there for a minute. Now, before this shoveling snow event where she got breathless, was she on heart medication?
Blood pressure medication and also aspirin.
Okay, has she had any stroke or heart attacks or chest pains or anything like that before this event?
She's had chest pains on and off, like when she exerts herself, if she walks too far, carries in groceries too far.
Yeah, I would be amazed if it was a birth defect, because this would have been noticed when the baby was born, not when she's 57 years old. Okay.
They did do a CAT scan. And they did do another test, a dye test on her. But he said today, the cardiologist said, because of your symptoms, we're going to do this. That caught my attention because of what I learned.
So what was the result? What was the result of the dye test?
The dye test showed a blockage of a pinching, not blockage. They said that 0 blocked for calcium buildup, 0.
Blockage at first, so they did.
Was a block. They thought it was a blockage, so they actually just went ahead and started trying to put the stent up there, but they couldn't get the stent up there, so they took the stent back down. Error, and then they said, let's keep her in overnight and let's do the CAT scan then the next day.
Okay, I'm still not with you. Did they find that she has a compression or a pinching of one of those arteries?
Pinching, that's the word, pinching. But it's rerouted. He also said it's kind of like a little detour. It goes between 2 arteries, and they believe.
Yeah, well, here's what happens. Your heart wants to have blood to itself, and when there's arteries that aren't doing their job, they may be partially blocked or pinched. They'll actually grow other arteries and reroute themselves and so forth, given time. And so that's not unusual for that sort of thing to happen. 240 pounds. She's a little heavy here. At 5'7" for a lady, I'd like to see her weigh like 150, 160. So she needs to lose about, I'd say, 90 pounds maybe. We need to have her lose 90 pounds. And we can actually help her support healthy blood pressure. We can support healthy blood flow through even arteries that are 95% blocked. Did they give you a percentage of how much blockage there was because of that pinching?
No, only when she exerts herself does it start to pinch then.
Yeah, okay, so they didn't give a percentage of blocking or anything like that. Okay, at 240 pounds, I would give your sister 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month, a full dose of everything twice a day. And because she has high blood pressure and she has this artery problem in her heart, I would also give her 2 bottles a month of the Ultimate Daily Classic tablets. I'd have her take 3 of those Ultimate Daily Classic tablets twice a day. And they're going to support and promote healthy blood pressure. They're going to support and promote healthy blood flow through obstructed and pinched arteries. And for the weight, in addition to getting rid of all the bad foods, the fried foods, processed meats, oils, and gluten, no wheat, butter, and oats, I would also have her take 2 bottles a month of the Rev, R-E-V. I'd go ahead and put 2 droppers full under her tongue before each meal. Leave them absorb through her oral tissues. 1 dropper full would go on her tongue 30 minutes before the meal, and the second dropper full would go under her tongue 15 minutes before each meal. Within 7 to 10 days, she should start losing a half a pound to 2 pounds a day, and it's not unusual to lose, 90 pounds, 110 pounds, that kind of stuff. She would require something like 4 to 6 months to do it comfortably, and of course, as long as she stays on her 90 for life, obviously she she would cut everything in half because she'd be half the weight essentially, right? And when she gets down to her proper weight, she can cut all her supplements in half. And as long as she stays in the 90 for Life program, the miracle here is she'll never gain the weight back. And so, give us a call every 2 weeks. We'll walk you through this. We just need to know her blood pressure levels, her body weight, so we'll kind of understand, how well she's sticking to the diet and taking the Rev and the other supplements. And every time she goes into the doctor, he's going to examine her, EKGs, CAT scans, all that kind of stuff. We'll know what's going on with those arteries. And so let us know that. But call us in 2 weeks. Let us know, again, weight and blood pressure and how she feels and so on.